for everyone's benefit, I've started recording the session so that those who missed can also watch. I know that everyone's super excited for this session. So without much time, I welcome Dr. Narendra Malhotraji, who is one of the India's finest doctors, hailing from Agra. He's pride of India. He delivered thousands of babies and represented India at a global stage. He has been the past president of Foxy organization, which is the world's largest organization for all the obstetricians and gynecologists. He's very innovative, creative, dynamic, and super energetic. It's his idea that why don't we show the labor room directly and answer every single query of you expecting mothers. So for the first time ever, Dr. Narendraji is showing the labor room, what happens right from the moment you feel the labor pain till the end of your delivery. So Dr. Narendraji is going to demonstrate live everything rather than explain, as well as explaining it. And he'll also be taking some of your questions at the end of the session. So this is a one of its kind session ideated by Dr. Narendraji himself. So without wasting much time, I welcome Narendraji. It's 12 o'clock and more than 225 participants are ready to eagerly listen for you. Over to you, sir. Sir, we can't hear you. You're muted.
A very, very good noon to everyone. Namaste. It's indeed a pleasure to be here at imumz again to address you and show you what a labor room looks like. So where I'm sitting is my labor room is behind and my pre-labor room is on this side. So wherever you go, whenever you are in pains, you will come to the doctor and the doctor will give you an examination. The examination is, why I'm not audible? Ravi, am I audible? Someone is saying I'm not audible.
Sir, I think it's the audio setting from their side. You're audible for us.
Okay. Yeah. So please set your audios rightly. I am audible, I think, to everyone. So when you come in labor, and that is in pains, first we have to understand when you have to report to the hospital. So when the pains start from your back and come forward, and they come periodically, they will start as random, and they'll start with heaviness, and you'll feel like going to the toilet a lot, and you'll feel something is coming from the back. They'll be incoordinate in the beginning, and then they'll start coming regularly every half an hour, then every 20 minutes, then so that is a time. Or if you get a leaking, and leaking means that a clear discharge which comes out from the vagina with or without pains. And when your cervix opens, the mouth of the uterus opens, you will get a little bit of red colored discharge, which we call a show. So let us see when you reach the hospital, what the doctor is going to do. So when you reach the hospital, you're going to be taken into the pre-labor room for examination. And we're going to walk to the pre-labor room. So we're going to walk to the pre-labor room, and behind the pre-labor room, you will see there will be a lot of instruments and trays, and some of the people will have some music going on. In very cramped up labor rooms, there will be a lot of patients, there will be a lot of halla. There will certainly be some chaos, nurses running up and down here and there, and nurses running up and down to see the patient, and some patients yelling in pain and what not. So here is my patient will come, and this patient is sorry. So we will. So here is a patient who has come, and she is made to sit here. We'll take the blood pressure. Blood pressure and pulse has been recorded by the anesthetist, and then we are going to ask her to come on the bed. See, very nicely, comfortably, the patient is walking. क्या हो रहा है? दर्द हो रहा है? बहुत दर्द हो रहा है इसको. Okay. So you will be made to lie down, and then the blood pressure will be taken in again, and the doctor will probably be on your right side and will examine because how much your fundal height is. So she's full term. Then she will or he will feel that the contractions are coming. पीछे से आगे दर्द आ रहा है? बस बस. So she's having a lot of pain in labor, and then we will put the NST machine. So we have the NST machine, and you have the cordless thing, and then we can put that and get the heartbeat recorded. Now, sometimes the recording is going to be continued in labor. So that is what we call as continuous labor monitoring. Otherwise, at admission, a 20-minute heart recording should be done of all the pregnant patients. So 20-minute, we call this as admission test. Admission पे आए, आपका 20 मिनट डॉक्टर ने एक रिकॉर्डिंग लिया, एक ट्रेसिंग आया, ट्रेसिंग में अगर हार्ट बीट नॉर्मल है 120 से 160 के बीच में, बेबी के मूवमेंट से फॉल नहीं हो रहा है, पेन से फॉल नहीं हो रहा है, डिसेलरेशन जिसको कहते नहीं हो रहा है, then it is very good. So that will tell us that. So that will be done first. Blood pressure, pulse, recording and all. Then we will do a per exam. The doctor will give you an internal examination. So she is having pain, and then we will do. The doctor will give you an internal examination with the glove, and by this time some blood tests must be done. If they are not there, that those will be done again, and especially in these time a COVID test, antigen test will also be done. So when she is properly covered, we will do a per vaginal examination and push and this thing, and then they will assess how much the dilatation is. And the dilatation will be recorded on the partogram. So your labor will be monitored, and see, when she came, it was at 4 centimeters here, and she came about 2 hours before abhi right now. So now it has been 2 hours at least. PV is not done in 2 hours, done 4 hours, but we are showing you now. She, her dilatation has become 6 centimeters. So the labor is progressing well, and she will be monitored for labor. So I'm going to leave her in the labor room and show you what will another 3 or 4 hours. My assistant, Dr. Manpreet and Dr. Anita, will be looking after her, and they will bring her in the labor room. Come, let's go into the labor room now. So when we walk to the labor room, you see that the labor room has to be next to the plate. Because sometimes in some hospitals, they may make you stay in the room, and so you are comfortable. But we need a comfortable labor room, so we follow the NABH standards, and we follow the FOXY Manyata standard. So there is a Manyata which is given to the FOXY. Now, labor room has a good, nice, broad bed, so the patient can lie comfortably. It has a drape, and the drape has a collection thing, so whatever water and everything leaks can come into here. All the emergency trays are on the labor room. There will be a small anesthesia machine in the labor room, a monitor in the labor room to monitor the mother, a drugs trolley in the labor room, and of course the fetal Doppler. So when the patient is here, either we bring the NST machine, or the doctor will check the heartbeat by the doctor. And that is how we will keep a track that the baby is doing well. And then of course we will have, when she is ready, we have the instrument trays. Now please, इंस्ट्रूमेंट देख के डरना नहीं है, ये कैंची रखी हुई है, डॉक्टर ने ये रखा हुआ है, वो रखा हुआ है. बहुत सारे पेशेंट इंस्ट्रूमेंट देख के डर जाते हैं. डू नॉट गेट स्केयर्ड. These are normal instruments which will be used to give you episiotomy and all. Then of course in the labor room only a baby radiant warmer has to be there. Right? So baby radiant warmer, we have kept it on because the patient is going to deliver very soon, and we keep the temperature at about 36, 37. We keep the humidity this rising still, and it has got a suction, it has got oxygen, it has got all the baby tray which will be needed. So if the baby does not breathe, there is a checklist of what the. So you, when you deliver in a hospital, please go and ask the doctor, show me your labor room. मैं कहाँ deliver होंगी, मेरे को दिखाओ. कैसा माहौल है? तो अच्छा सा फ्लावरी माहौल, एक बड़ी सी घड़ी लगी हुई है, आपसे सब लोग प्यार से बात कर रहे हैं. That is what is required. And that is what is known as respectful maternity care. हम चाहते हैं कि आप एक बहुत अच्छे से, और आपके लिए एक डिलीवरी, नॉर्मल डिलीवरी होना एक बहुत सुंदर और अच्छा एक्सपीरियंस हो, rather than you see medical colleges और ये बड़े busy hospital, गवर्नमेंट हॉस्पिटल, एक कमरे में 10 लेबर टेबल होते हैं, वहां वो चिल्ला रहा है, वो डिलीवर हो गई, उधर जोर लगा, इधर कर, उसको ये निकल गया, उसको बहुत कंफ्यूजन होता So we don't want any confusion. सब अच्छे से होना चाहिए, comfortably होना चाहिए. So आइए, any questions till chief ready? तो किसी को अभी इससे में कोई सवाल है तो मेरे से पूछिए अभी. Till we are waiting, please ask your questions. You can unmute and ask, or you can.
If you want to directly ask, so far, doctor has shown the pre-delivery room, and so Dr. Narendra ji is open to take some questions. Aapko whatever questions you have, either you can type in the chat box, or you can click on the unmute button, and I mean raise your hand button, and I'll unmute. So doctor, we have some questions. Can normal delivery happen after C-section?
So see, my patient is almost having very severe pain and she's getting ready. So they are shifting her and she's yelling. So we let them walk. If they are about to walk, we let them walk. Otherwise, take them on the wheelchair. So there she goes into the labor room. We'll join her immediately. C-section, C-section के बाद normal delivery को V-back कहते हैं, vaginal birth after C-section. So chances हैं अगर C-section आपका उस रीजन से हुआ है जो रिपीटेड रीजन नहीं. सपोजिंग सी सेक्शन पहला ब्रीच डिलीवरी की वजह से हुआ, उल्टा बच्चा था. सपोजिंग सी सेक्शन पहला लीकिंग की वजह से हुआ, नॉन प्रोग्रेस लेबर की वजह से हुआ. सपोजिंग पहला सी सेक्शन आपका किसी और कारण से हुआ, प्लेसेंटा प्रीविया से. एंड ये कारण इस टाइम नहीं है. दिस टाइम एवरीथिंग इज नॉर्मल. यू आर इन normal labor, you are in normal position, you're dilating. That should then yes, you can have, but it is difficult whenever it has to be monitored very carefully. And when you monitor very carefully, then pains and thing. So, but ho sakta hai, yes.
And doctor, we've also seen people, those who are meditating, listening to music, doing all their yoga inside the imumz app. They're also reporting BBAC cases. So
antenatal yoga exercises, antenatal meditation, antenatal exercises, antenatal garb sanskar is very, very important. So very, very, yes, Navita, some words I'll speak in English. Mostly it is in Hindi, mostly it is English. So that is very much required that you meditate and get prepared. Now you see behind me, there is a lot of activity going on because she is getting fully dilated. And she's good. So that now someone is asking about epidural. Epidural anesthesia is a needle which is put in your bag and the catheter is fixed there, and it is for painless labor. Now and then whenever you get pain, a little bit of medicine is injected, so the lower portion is anesthetized and you don't feel pain. Yes, epidural is safe. Epidural is good. It is painless labor. But some people believe that labor should be pain should be felt. That is also a good thought. And with epidural, see, you will, when you don't feel pain, then you don't push. And if you don't push properly, then you will end up getting vacuum deliveries or forceps delivery. So a little bit more chances of instrumental deliveries. Yes.
Yeah. Also, sir, one thing I want to tell everyone, the labor which is happening in this video is a mock delivery. Some of you are DMing me. So everything is done by the hospital staff to show you a realistic view of how it happens. So it's not a real delivery, it's a mock delivery which was happening.
So this is how we train. There is an instrument called Mamanatelli. Mamanatelli has been tied on our abdomen and there is a baby inside, there is placenta inside, there is blood inside also. So we'll show you how it comes out, what are phases. So just to remove the scare of you. Now, can breech delivery happen normally? Well, breech delivery happening normally is not a good idea, because especially if you are first and it should be a cesarean, it marks for an indication in the Robson's criteria for a cesarean section. So breech delivery should be done by cesarean section. So,
Mithali, you want to ask your question? Mithali?
Yes, sir, I just wanted to ask, pain चालू होता है, फिर कितनी मिनट्स हम लोग घर पे रह कितना टाइम, आई मीन हॉस्पिटल जाके फिर वो टेंशन लेना कि अब कितना सेंटीमीटर हुआ. सो इज इट बेटर कि हम लोग घर पे थोड़ा टाइम निकाल के फिर हॉस्पिटल जाए?
So from the start of pain to full dilatation will take you 12 hours if it is your first baby. and will take you 6 to 8 hours if it is your second baby. So 1 or 2 hours you can let the pain come regularly, because sometimes they will come irregularly, but then they have to come regularly from the back every 15 minutes. Then it is the time. Or if you've started leaking और ब्लड आ रहा है, ज्यादा ब्लड आ रहा है, या कुछ ऐसा गड़बड़ लग रहा है आपको सांस लेने में दिक्कत हो रही है, ब्रीदिंग, और यू आर हैविंग हार्ट बीट पैल्पिटेशन, then you go to the hospital early. Otherwise 2-3 hours you can take the pains at home.
Okay sir, thank you.
Thank you, Midali. Arpita, please ask your question. Hello Arpita, I've given you access to unmute yourself. Can you please unmute and ask?
Hi Ravi, thank you. Good afternoon doctor. Actually मैं पूछना चाहती थी कि जब हम लोग का लेबर पेन होता है तो एनेस्थेसिया मैंने सुना है सिर्फ लोअर पोर्शन में दिया जाता है जो स्पाइनल कॉर्ड में होता है. सो क्या वो सेफ है? क्योंकि मैंने 2-3 दिन से सुन रही हूँ कि मतलब वो फॉर अ फ्यूचर में वो बहुत प्रॉब्लम होता है. लाइक हम लोग झुक के काम नहीं कर सकते और भारी सामान नहीं उठा सकते. इज इट पॉसिबल कि आप मतलब पूरे बॉडी को अगर एनेस्थेसिया किया जाए, नॉट ओनली सिर्फ लोअर पोर्शन को?
सो लेबर के लिए एपिड्यूरल एनेस्थीसिया है जो कि नीचे के हिस्से को ही दिया जाए. अगर हम आपकी पूरी बॉडी को जनरल एनेस्थीसिया दे देंगे तो आप बेहोश हो जाएंगे, और लेबर आपका चलेगा 10-12 घंटे. तो 10-12 घंटे आपको बेहोश नहीं रख सकते. सिजेरियन सेक्शन करना हो तो क्विकली जनरल एनेस्थीसिया और निकाल के और बेबी डिलीवर. ये तो जब पेन आता है तब थोड़ा थोड़ा. वो जो आप डर रहे हो कि वो जो नीडल आपके बैक में जाएगी वो बैक एक करेगी, वो ऐसा नहीं है. दिस इज अ बिग मिथ. दैट नीडल इज वेरी थिन, इट डज नॉट गिव फ्यूचर बैक एक्स. लेडीज को बैक एक, उनको लैक ऑफ एक्सरसाइज और उस सब वजह से होता है. तो आप वो एक्सरसाइज बाद में करेंगे, सब करेंगे तो बैक एक, उससे मत डरिए. जो एपिड्यूरल का डर है वो आपको थोड़ा इंस्ट्रूमेंटल डिलीवरी ज्यादा होने का. सो कैन अ ब्रीच बेबी टर्न टू नॉर्मल एट 36 वीक्स? वेरी लेस चांस, बट इट कैन, स्टिल कैन. IVF twins can be delivered normally. Well, IVF twins is better to deliver with cesarean section and not normal. AFI low. AFI क्या होता है? AFI amniotic fluid index. So आपके बेबी के अराउंड जो वाटर होता है that acts as a shock absorber. So it absorbs all the shock and it absorbs all the pains and protects the baby away. So अगर amniotic fluid less है, that means 5 से less है, so and but आपको लेबर स्टार्ट नहीं हुआ है, तो बहुत चांसेस है कि आपको नॉर्मल डिलीवरी नहीं होगी और आपको वो करना पड़ेगा. See, water burst, as soon as your water burst, you probably must head towards the hospital, though it does not mean that immediately डिलीवरी हो जाएगा. डिलीवरी ओनली होएगा जब आपका सर्विक्स फुल्ली ओपन होएगा. 31 weeks पे AFI 19 है. Up to 20 we say it is high normal. So if the sugar is normal, if the baby is normal, then don't worry, कोई उसमें प्रॉब्लम नहीं है. Fetal weight is more at 36 weeks. Well, the doctor has to see why it is more, and then. So come on, let's deliver this baby first, and then we'll answer, because she's yelling now. So when we go into the labor room, and you see that the doctor is already ready to deliver this baby already ready, and she's crowning. That means the baby's head is coming out. That is crowning, and she's yelling around. Sometimes you can put drip, एक oxygen mask. Sometimes अगर epidural anesthesia नहीं लगाया है तो इसको नाइट्रस दे सकते हैं सूंघने के. तो नाइट्रस गैस सूंघने से भी आपको जो है आराम मिलेगा. तो ये जो मास्क है, कभी कभी डॉक्टर्स आपको ऐसे करके नाइट्रस गैस है उसमें से नाइट्रस गैस दे सकते हैं, उससे भी पेन थोड़ा रिलीफ होता है ड्यूरिंग द डिलीवरी टाइम. और बाकी आपको लोकल एनेस्थीसिया नीचे डॉक्टर ने लगाया हुआ है. अगर एपिड्यूरल लगा है then there is no need of any local anesthesia. So then it is push. जब दर्द नहीं आए तो लंबी सांस लो. ब्रीदिंग एक्सरसाइज
चलो पुश करो. लगाओ.
So प्यार से इसको डील करना, that is very important. And there comes the baby. So as soon as the baby is delivered, we will give it to the mother, show it to the mother, and if possible, उसको जो है अगर breast feed के लिए ready है तो breast से लगाना चाहिए, because first touch of the baby is very very important for you. तो baby को doctor अगर unless कोई problem है, baby को premature है और वो है तो immediately neonatal उस पे. Otherwise we'll just give, the doctor will just give a baby a mild rub, just show it to the mother. So she's happy, take a good picture with her and put her on the mask, and we will do some suction so that jo mucus hai, see how happy is, she's forgotten all her pain and everything. So that is what, and this time pe we will cut the cord and detach the cord, and abhi usko clean karke dete beta tumko, and we'll take the baby in the tray to the neonatal trolley, which is right in the labor room, और वहाँ उसका suction और checkup जो pediatrician करेगा. So that is how a normal delivery experience will happen to you. अभी खत्म नहीं हुआ है, अभी placenta निकलना है. So we will wait. Placenta active management of third stage होता है. So we, in the meantime, we've given an injection called carbitocin or prostadine or syntocinon in the drip or directly, जिससे placenta निकलना easy हो. And when placenta delivers, then we give the uterus a massage. So आपको bleeding PPH नहीं हो. अगर PPH होता है, which is bleeding excess, then PPH के kits है, we will do all the PPH. This time we shall push a little bit more. This pain will be a feeling like urination. First was feeling like defecation, या motion निकल रहा था, and then so अभी हम लोग ने जो placenta को जैसे cord को control करके निकाला, then we check placenta की cord side है और placenta की baby side है. So सारा placenta completely निकलना चाहिए, and when the placenta, अभी अगर आपको cord blood वो कराना है banking, तो placenta अंदर रह के ये cord में यहाँ सुई डाल के cord blood एक banking, cord blood का box लाना बेटा, तो cord blood आप collect करा सकते हो. ये cord blood बच्चे को बाद में any diseases happening because stem cells होते हैं इसमें, तो stem cells. So those who believe in cord blood, today it is believed that a lot of diseases will be cured in the future by stem cell banking. So yes, this is the time where you can, but you should tell your doctor before and understand everything before. And stem cell kits, you will have to get the kit. So you get the kit from the company, you negotiate the rates. There are 3 or 4 companies which give you good cord blood sampling, and this has all the kit. The doctor should have this kit, or you should bring it at the time of delivery, so we can take out and collect the cord blood and send it to that company for storage for 20, 30 years. You have some disease like diabetes and all later on. Baby has some disease like leukemias, blood cancers. All those can be cured by cord blood sampling. Now this patient is she's a preemie. So a small episiotomy was given. आपने किसी ने पूछा मेरे से episiotomy, I will just answer. And now the doctor will just give a couple of stitches in the episiotomy and tell you care of this episiotomy. So it is a very simple, pleasant thing which you to deliver normally. And that is what most of the obstetricians want. You should deliver normally. 80% patients will deliver normally. But what has happened today is previous cesarean section. Many diseases, many lifestyle modifications. That is why the cesarean section rate is a little higher in institutions. So it could be 30-40%, but still about 60% babies will deliver normally if you are ready to take the pains and you are ready to cooperate in the whole thing. So your labor preparedness is very, very important, and that is why this app is with you for imumz to prepare you and be a companion in pregnancy and during labor. Let's go back to the laptop and then we'll talk about it. We'll see the baby once again. So after I delivered, I'm going to come and fetch the baby. So we have the cord clamps. Now we will put the cord clamp on the cord then suction has been done. Otherwise the suction is done a little bit. The baby's mouth is kept open and some suction is done. And then we check the baby for fingers, hand, for latrine places, for anything, any injuries or anything. And of course, then we will give the baby, if it is normal, or to the mother's side. If it is premature, small, or has breathing difficulty, it goes into the NICU for a few hours or maybe a couple of days, and then it's given back to the baby. So that is how a normal delivery, a mock delivery will occur and will happen in it. And now we will take all your questions which you have.
Sir, one popular question asked by many people, that's why I'm taking it.
Yeah, I see there are lots and lots of questions. And yes, we are ready to answer.
One question which 4 or 5 people
So
have
breast
asked.
crawl. Yes, breast crawl is started immediately. And I'm going to give Ravi a video and he will put it on this thing of actual breast crawl. The baby is kept on mother's abdomen and it just attaches to the baby and it tries to crawl towards the breast. So that is known as breast crawl. Otherwise, we make the baby take the breast nipple in the mouth. So we can do it.
Sir, can husband...
29th week, labor has not started yet. So if you don't start labor at 39 weeks, Indian pregnancies are usually 40 weeks. And we have a little bit of lesser gestation as compared to the Western. So in the Western countries, they wait till 41 weeks. But for us, waiting for 41 weeks is not advisable as per my personal experiences. But if everything is going on normal, Liker is normal, fetal heart rate is normal, the baby is showing signs of descent, we can wait to 40 weeks. After that, we need to induce yourself. So single umbilical vein, someone was asking, single umbilical vein is picked up by ultrasound in the 3rd month of pregnancy. Usually, if it is the only marker, it is of no problem. But if it is if there is a problem, other markers are there, then yes, single umbilical vein, you have to do the chromosomal testing. So it could be there.
Pranavi, can you please ask a question now? Hello?
Yes, sir. Yes, thank you, sir. Sir, if after some contractions, if water breaks at home, so we will go to the hospital, right? So immediately we have to go for a C-section, or can we try for a normal delivery?
No, water breaking is not an indication for C-section. Water breaking can happen. The cervix can start dilating a little time afterwards, or it must have dilated first. So the doctor will do the assessment by internal checkup. And if the cervix is soft and the os is opening, then we will definitely wait for normal delivery. Otherwise, also, we wait for normal delivery and we put some medicine on your cervix to let it open up and wait for a 3-4 hours. Immediate water breaking cesarean section is done, but in some cases, but normal delivery is tried first.
Okay. So, sir, first time if it is that happened, so is there a chance for the second time? Can same thing happen? Or
water breaking can happen to anyone anytime. So it is usually because of vaginal infections. So keep your vaginal hygiene proper and healthy, then water breaking usually. But it can happen to anyone anytime. Yes.
Kirti, you want to ask a question? Can you please quickly ask? Unmute yourself and ask. Kirti?
ये कैमरा नहीं आ रहा कुछ भी इस कैमरे पे कुछ नहीं आ रहा ऑफ करा है कैमरा
Pooja, you want to ask a question? Pooja Malvi, you have raised your hand. Can you please ask a question?
कोई भी वो रेस की वो बच्चों
Okay.
So in which week C-section is safe? Now your baby is mature after 37 weeks. So if planned cesarean section is planned, then we try to take it to 38 weeks. AFI 7 at 37 weeks is normal. So don't worry, 7 AFI is on the normal limit.
Pooja, please ask a question.
Yeah. Sir, oxytocin injection is safe for us or not? I heard that all doctors are means sabhi de hi dete hai or they are not waiting for the labor.
So जब भी labor को start करना हो, when we want to start labor, oxytocin is the only medicine to start labor, induction of labor, and augmentation or increasing the pains. So oxytocin is very safe drug. In 10 minutes, it is metabolized. So it causes no side effect. It will be, it is given in the drip to start labor or to make the labor pain stronger if the labor is not progressing well. And after delivery also 10 units of oxytocin is given for prevention of PPH, postpartum hemorrhage, and for placenta separation. So after that, but today we have carbitocin for after delivery, but before delivery only oxytocin can be given. Carbitocin and prostaglandin and lethargin, these 3 injections are given after delivery depending on the doctor's choice and availability. And thoda carbitocin expensive hai, isliye वैसे used.
Ashwin,
Hello,
can you ask
doctor.
your question?
Actually, I have heard multiple cases around me that the baby has passed meconium in the womb itself, and that's why it was a emergency C-section. So, can we avoid passing meconium in the womb?
So baby, you cannot stop the baby passing meconium in the womb. जब भी उसको potty आएगी तो करेगा. और womb के अंदर जो potty करते हैं वो that is some distress is happening, that maybe the liquor is less, maybe there is a strong pain, maybe there is some injury to the baby, or maybe date से ऊपर हो गया है, post date हो गया है. So all those causes could be causing meconium in the baby. And meconium, if it is passed, if it is very thin meconium, we can do the membrane rupture and wash the meconium. We call, if the labor is happening, delivery hone wali hai, so we can do the washing of the meconium and let normal delivery. But agar thick meconium hai, so then baby is going to swallow and breathe it, and it will block the nose and it will go into the chest, and it will cause what is known as Meconium Aspiration syndrome, which is dangerous for small babies. So it is better that a cesarean section is done if meconium is there.
Okay, is waiting after due date a chance for increased chance for passing meconium?
Yes.
How many days after due date?
So as I told you, in Indian pregnancies, they don't go up to 41 weeks as the Western pregnancies. So 40 weeks is our total complete. Now baby can pass meconium in India anytime after 38 weeks. So for us in India, 38 weeks we take it as full term. And after that, labor should start.
Okay, doctor.
34 weeks utero-placental insufficiency. What does it mean? So utero-placental insufficiency means that your uterine artery, which supplies pure blood to the placenta, is not supplying pure blood, or your placenta has stopped working because of premature maturation of placenta, calcification in the placenta, placental infection, post-date, everything. So that if it is mild, we are not worried. If it is moderate to severe and the placental cerebral ratio is 1 and more, that means baby is getting more blood in the brain and placenta is getting less blood. So baby is trying to save the brain, then that could lead to problems later on. So that has to be very carefully monitored. Now, are husbands allowed? Yes, we allow husbands, even mother-in-laws, even sister-in-laws, if they don't interfere. And if the husbands can just quietly watch and not get scared of the blood. So husbands who have taken part in the breathing exercise with the women during the antenatal exercise period are most welcome inside, because they can help the lady do breathing exercise in labor. And they can hold her hand and be very compassionate, so that one doctor or one staff which is required, the husband role can be taken over. The husband can take over that role.
Lovely advice, Doctor. Shaista, can you please ask a question?
Yes, thank you, sir. Actually, sir, I have a problem. When I'm home, my blood pressure always came normal. But as soon as I reaches to doctor, then it increases and I don't know how to control it. I just got so nervous, or it's because of anxiety. It just increases. I don't know how to control it. And
So
they
first,
actually prescribed me some blood pressure medicine, and now I'm in, or I have to take it or not.
So firstly, you take your home blood pressure instrument to the doctor's clinic.
Okay.
So we must check it on the same instrument. There could be an instrument problem. Of course, going to the hospital and seeing a doctor, anxiety problem is there, but anxiety will increase the upper blood pressure, not the lower diastolic blood pressure. So if your upper blood pressure goes up to 140, 150, when you are with the doctor, I don't think it is very worrisome. A mild medicine would be available. But if the lower one is also high, that means the BP is high. And for that, now labetalol medicine is very, very safe. It works only and it helps the baby because if you get high blood pressure, your baby will not get blood properly. So taking labetalol 1 or 2 tablets a day is no problem. It will stop after delivery. So please take that if your lower blood pressure is also high.
Okay. Thank you so much.
Thank you. There are so many questions. We're trying our best to take as many. Those who want to unmute, please click on the raise your hand button. I'm quickly unmuting everyone. So the next one, Vinaya, can you please go ahead? Sorry. Can you please unmute yourself and go ahead again? Yeah.
Hi, sir. Good afternoon. I just want to ask on behalf of my wife, if the cervix length is small and it's around 2.5 and we feel a little bit pain. So what precautions we need to take and how to determine when there is urgency for delivery?
So cervix length is measured first at your NT-NB ultrasound scan, 13 weeks.
Yeah.
And it should be more than 2.5. Then it is measured again at your anomaly scan, 18 to 22 weeks. And it should be again more than 2.5. If it is less than 2.5, it is known as short cervix. And if you have short cervix, you are likely to deliver preterm. So at that time, the doctor will decide if it is shortening every week, then to put a McDonald stitch, or now we have pessaries also to put pessary so that your cervix does not shorten. Short cervix, and if it keeps on shortening, indicates that you are going to deliver early before term. So you have to be very careful with that.
Yes, sir.
Yeah. Amrita, can you please go ahead?
Hello, sir.
Hello.
सर मेरे को ये पूछना था कि क्या एपिड्यूरल सेफ होता है?
एपिड्यूरल बहुत सेफ है. एपिड्यूरल में एक सुई आपको बैक में लगाते हैं, लोअर बैक में, और उसके थ्रू एक प्लास्टिक का कैनुला अंदर छोड़ देते हैं और सुई को बाहर निकाल लेते हैं. फिर जब भी आपको पेन होता है, थोड़ा सा पेन का ड्रग उसमें इंजेक्ट करते रहते हैं. और ये फुल डिलीवरी टाइम तक और डिलीवरी के बाद भी, और अगर सिजेरियन होता है तो सिजेरियन के 1-2 दिन बाद तक भी रख सकते हैं और फिर उसको निकाल देते हैं और कुछ नहीं होता. इफेक्ट सिर्फ 10-15 मिनट 20 मिनट लास्ट करता है. इट इज वेरी सेफ, बट इट शुड बी गिवन बाय अ वेरी एक्सपीरियंस्ड एनेस्थेटिस्ट एंड in the hospital, in the labor room properly. But it is safe.
लाइक आफ्टर एपिड्यूरल तो बैक पेन का प्रॉब्लम तो नहीं होगा?
बैक पेन एपिड्यूरल और नो एपिड्यूरल, विमेन को बैक पेन होएगा ही, बिकॉज विमेन हैव दिस uterus there, infections there, bladder there, and lack of exercises, proper back strengthening exercises. So you do that and there will be no back pain.
Okay, thank you, sir.
Thank you, Amrita. Kirti, please ask the question.
Good afternoon, Dr. Malhotra. This is Kirti. My question to you is, I'm pregnant for the second time in my 37th month. The doctor has mentioned that the baby has not yet turned his head upside down. So is there any exercises or is there anything that I can do so that, I can have the second delivery as normal again? I had the first delivery as normal. And my second question is, the baby's weight for the first delivery was 3.6. Although it was 3.6, I had a normal delivery. However, this time the doctor mentioned that there could be a more weight gain of the baby, and then it would be a little difficult for us to have a normal delivery. So I am looking forward for trying to have a normal delivery. If you can guide me, please. Thank you.
So at 37 weeks, it is difficult for a 3.8 kilo baby to turn because there is no space there. Because you're already so the whole thing to turn like that, baby, so is a little difficult. So, but still, squatting exercises, putting your feet up, lying on your side with a pillow in between your legs, keep the legs apart. And there are some yoga exercises in the imumz app, which we have given for a baby's position to be. But it is a little late for this baby to change position. And if it is 3.8 kilos, then again, 3.8 kilos to change position and deliver normally might be little unsafe for the baby. So if it is not turning in the next week, then I would suggest you at 39 weeks and have a safe cesarean section. See, this is the normal position of the baby. Now, if it is like this, which could be foot first or which could be bums first, for this whole, it's in the abdomen. This is about a 3.8 kilos baby. So for it to turn the whole way and fix up like this and then go down is a little difficult when it becomes full size. So when it becomes full size, the problem. So they usually turn before 35 weeks. Yes, they can turn in labor also. I'm not saying it has not happened. Once a while they can happen, but that your obstetrician will assess you internally, how much space your pelvis has and what are your chances of turning.
Okay, thank you so much. We'll keep you posted. Good day.
Thank you. Smita, can you please ask your question?
Yeah, sir. Hi, Smita here. There have been a lot of questions regarding epidural. What I wanted to know was that are there any specific conditions in which the doctor says that we cannot give you an epidural, or like is it is there a specific time in between where you have to be given and after that you cannot be given? Like, are there some conditions attached to the administration of epidural?
So epidural anesthesia is given before cesarean section or spinal anesthesia. So the effect wears out. And if we want the painkiller to go for next 24 to 48 hours after cesarean section, it is a very good method to have post-operative pain-free period also. So epidural 1 is given there. Then those women who want, I'll tell you who cannot be, who want painless delivery, epidural is given when they come into labor and they are at least 3 to 4 centimeters dilated. We don't give it very early and we give it when the labor is starting, so that only 12 to 24 hours maximum we have to give. Now, those who cannot get epidural are those patients who have low blood pressure, who have other diseases where a monitoring will be required. If it is a very busy hospital with many deliveries, then one anesthetist has to sit with the patient. So there also probably sometimes epidural is not encouraged. And those patients who have back problem, there is a backache, there is slip disc, and all those, absolutely no to epidural. So it has its both up and downs. Only those patients who insist that they do not want pain and they want a normal delivery, we encourage epidural. Otherwise, the pain is not that much. So if you are mentally strong, bear the pain and see. It is enjoyable pain.
Okay, sir. Thank you.
Thank you, Smita. Alekia, please ask your question.
Yeah, thank you, Ravi. Thank you, doctor, firstly, taking your time and letting us know about the labor room and peri-labor room. Thank you so much for that. So as you said earlier, like once the labor start, till the 3 hours, maximum of 3 hours, we can stay in home, aram se, and we can rush to hospital. So my question is like, till the 3 hours, should we walk or should we sleep? Or I mean, not sleep means in the sense like lay down or sit. So what is the best position at that time?
So you have to do walking. You have to practice all the breathing exercise you learned. You be sure that your bag is ready of the baby and your papers are ready. Don't forget them in a hurry. Suddenly, if you have to rush, walking is a very good idea. Squatting is a very good idea. Squat. Ask your husband to give you a nice back rub. That is very important. Very important at this stage. So that and make yourself strong. Do some meditation, do some affirmations. I am strong, my baby is going to deliver, my fetu is coming, and I'm going to have a nice time. I'm not going to be scared of pains. So have positive affirmations towards to you. Keep yourself clean. Don't eat ghee. Your mother-in-law will give you a glass full of ghee.
Okay, no.
So ghee, the older people believe the more ghee you eat, it will go in the vagina and make the baby slip out easily. So that myth is not. If you want the baby to slip out, apply ghee inside your vagina rather than drinking it. You drink you drink it, it will go on your hips and never come down.
Okay. Okay. Is it good? Can we drink water at that time, doctor?
Yeah. So drink liquids, lots and lots of liquids, but try not to eat too much of heavy food or too much solid because the pains increase. You will feel pukish and you will puke a lot. And supposing you require a cesarean section, then if you puke during the cesarean section, it can go into your respiratory.
Oh. Thank you, doctor. Thank you so much.
Thank you, Alagya. Yukti, please ask your question.
Yeah, thank you so much. First of all, thank you so much, doctor, for such insightful information. It's really helpful. So I am in my, I'm starting my 5th month now. And my question was that I have slip disc injury for last 4-5 years. There is a bulge in my L4, L5. So what is your advice? Should I go? Is it okay for me to go for normal delivery or should I go for C-sec? Any suggestions?
So if you go for a C-sec, then you will have to be given general anesthesia. We cannot give you spinal because that is the place where we give you the spinal or epidural. And I think it will be better that you have a C-sec rather than attempt a normal, because in the normal there will be a lot of pressure, and that pressure can make your disc bulge more and maybe cause injury. So it is probably safer. Your doctor will assess if you have got a good pelvis and you're progressing very well and you are not likely to have a very long labor, then maybe you can try. But I would suggest a C-sec better. And in general anesthesia, no spinal.
Okay. No spinal. Okay. So general anesthesia is something the doctor allows. I mean, that's not a problem. I can always discuss.
Not a problem. Only see what is general anesthesia is when we give anesthesia through your veins and through gas. So when we give it through the vein and gas, it goes to the baby. See, spinal anesthesia does not go to the baby. So the baby comes out crying and healthy. General anesthesia goes to the baby comes out a little bit sleepy and a little bit like tun, like do peg piyawa.
But is that okay?
It's okay. It's okay.
Okay.
It's okay. The pediatrician who will be assisting your birth will take care of that. So it's not a problem.
Okay. Thank you so much, doctor.
Someone is asking me about fibroids. Now, posterior and anterior fibroids, which are 5 centimeter almost, this will give difficulty in normal delivery. I'm not saying normal delivery cannot happen with fibroids. Normal delivery can happen with fibroids, but if they are in the cervix anteriorly, then maybe they will not let the head come down. So careful watching, and if you can progressing well, yes, go for a normal delivery. But if you go for a cesarean, tell your doctor to remove the fibroids during cesarean. That is possible. So that saves you an operation.
Thank you, doctor. Neha Chauhan is asking from when can she start squatting exercises?
Squatting exercise can be started from 28 weeks onwards.
Right. Every day, 6 p.m. to 7 p.m., there is live yoga classes as well. You can follow them. One question, 39th week cephalic position of the baby. Can it be normal? Is a question.
Absolutely. Cephalic is a normal position. All babies who deliver normal have to come cephalic. Cephalic means the head is coming first. Yeah. So head has to come, head gets fixed, and that is, so it's normal.
This question is from Priya, and she has followed the yoga and been very regular with yoga during her pregnancy. That also helped her, she is mentioning. Kavita, can you please ask your question? You can unmute yourself and please ask your question.
Hello, doctor. I'm not sure whether this question has been covered earlier. So as a to-be mother, so what can we do to increase the chances of normal delivery? There are so many myths. I'm not sure whether they are myths or actual they work, but what do you suggest?
So mentally strong, say positive affirmations, regular exercises, pelvic exercises, yoga, and squatting. That is what will help. That is the two things. Myths are there. Do follow the myths into a small ways. A lot of myths are that drinking a lot of oil and ghee helps in normal delivery. Well, that is a pure myth, because normal delivery, the ghee and oil which you drink does not go into your vagina. Someone relatedly asked me castor oil drinking. Well, in older times when we were learning, every laboring woman was given castor oil. Now, castor oil causes loose motions. And loose motions, when they occur through the rectum, they stimulate the uterus to start pains. So that is believed. But castor oil is very dangerous. They can cause you very severe loose motions and you will need drips. So please don't take it. It's no longer advisable to take castor oil and a glass full of ghee just before labor.
Doctor?
Hello.
Okay, so in my 4th month, I had low-lying placenta. I'm in my 7th month now, and it has just moved away from the os. So, is there a chance for the placenta to go in the low-lying position again before delivery?
No, it will go up now. It will go further up. It will never come down again. So, if it's going up, it's a very good sign. It will not interfere. You can have a normal delivery. It's away from the os.
Okay, doctor. And which placenta is good for normal delivery, anterior or the posterior one? Anything specific?
So the placenta could be anterior, posterior, right lateral, left lateral. It could be anywhere. It should be fundo-anterior is the best. That means at the fundus and on the anterior. Most of the placentas are going to be at that place.
Okay, posterior doesn't have a problem. It can still have a normal delivery, right?
No, posterior also no problem. In fact, posterior which reaches up to the os also can deliver normally.
Okay, doctor. Thank you.
Anterior reaching up to the os does not deliver normally, but posterior reaching up to the os can deliver normally.
Okay, doctor. Thank you.
Hello.
Yeah.
Yeah. Can I ask my question, sir?
Yeah, please go ahead. Please go ahead.
Okay. Thank you so much, Ravi, for unmuting. And thank you, sir, for a wonderful session. It's really helpful. I have 3 questions. Actually, I have diabetes before conceiving also. So I'm currently in my 10th week. And I would like to know how much units maximum can we take? Currently, it's going up and down right now. Earlier, I was taking 1000 mg tablet, but now doctor has recommended me insulin. So earlier I was taking 18 units before breakfast and 12 units before dinner. But now he has increased it to 20 units before breakfast and 18 or 16 units before dinner, actually.
So diabetes control is very much needed in your pregnancy because we cannot afford you to have more than 140 blood sugar after meals wala post-parenting and fasting more than 100. So we need a strict diabetic control. The units don't matter. Even they can go to 32, 40, don't matter, doesn't matter. It is temporary that you are put on insulin during pregnancy. After delivery, they'll put you back on metformin. So just take it whatever he says and keep your diabetes under control because diabetes affects the babies very severely.
Okay. Secondly, how long can we take the progesterone injections? Like currently also they're giving me like morning and evening actually.
So progesterone now injections are rarely advised because we have very good vaginal tablets and very, very good dihydroprogesterone tablets available and micronized progesterone. So, and the placenta makes progesterone. So the placenta starts functioning at 12 to 13 weeks. So if there is a high-risk pregnancy, the progesterone support by injection, which could be weekly or once a day, twice a day is not required. Required
it's basically vaginal gel, sir.
Nano gel is okay.
It's a vaginal gel. I don't know exactly.
Progesterone so 90 grams of vaginal gel once a day is enough till 12 weeks. And then you can go up to tablets till 20 weeks. And by chance, if there is a short cervix and risk of preterm, then one micronized progesterone tablet 200 or 300 till 28 weeks. After that, it is absolutely not required. In fact, it is not required after 12 weeks at all.
Okay. Because currently they are giving me morning and evening.
Once is enough.
Okay. Just
unless you
question,
have,
sir.
I'm not sure. Maybe the pregnancy has some problem. So maybe the doctor has decided that it's best to leave it on your doctor to decide.
Okay. Just last question. What should we consider the exact time, the birth time of the kid?
When the baby cries, the first cry or when the head comes out?
Okay. Thank you so much. Thanks.
Okay. Hi, doctor. Good afternoon and wish you very happy New Year.
Thank you.
So, doctor, actually मेरी वाइफ का 6 month का प्रेगनेंसी चल रहा है एंड इनिशियल फेज में ही डॉक्टर ने डायग्नोस किया था तो अल्ट्रासाउंड में उन्होंने डर्मोइड सिस्ट बताया था बट डॉक्टर ने बोला है कि ऐसा कुछ प्रॉब्लम नहीं है बट मुझे वही पूछना था कि ये जो डर्मोइड सिस्ट क्या डिलीवरी टाइम में कुछ प्रॉब्लम क्रिएट करेगा जो ओवरी का डर्मोइड सिस्ट है
तो अगर डर्मोइड छोटा सा है 5-6 सेंटीमीटर का है तो कोई प्रॉब्लम नहीं करेगा। अगर बहुत बड़ा है तो वो पेन में ट्विस्ट हो सकता है। ट्विस्ट होएगा तो वाइफ को बहुत पेन होएगा। सो अगर नॉर्मली डिलीवर कर सकते हैं आप डर्मोइड के साथ, और 3 या 6 महीने बाद उसको लैप्रोस्कोपी से ऑपरेट कराना। डर्मोइड को छोड़ना नहीं है अंदर, ऑपरेट जरूर कराना।
ओके अच्छा डॉक्टर जी, ये पूछना था कि कुछ लोग ये बता रहे थे कि आप अगर सिजेरियन करा रहे तो उसी समय डर्मोइड सिस्ट को भी निकलवा सकते हैं।
yes,
ऐसा कुछ?
बिल्कुल निकाल सकते हैं। दैट इज बिकॉज 2 ऑपरेशन क्यों करें, उस टाइम ऑलरेडी ऑपरेशन हो रहा है, डर्मोइड भी साथ साथ हो जाए।
Okay, so I think I would prefer this cesarean section because
yes, you can go for cesarean and get the dermoid removed same time.
Okay, thanks, doctor.
Thank you, everyone. I see there are so many questions, but in the best interest of time, we can take 5 to 6 more questions from Manisha, Shruti, Chandni, Neha Chauhan. Your question is answered if there is anything. Pooja Shinde, Saloni Rastogi, Dipali. We might take these questions only. Rest others, there is a WhatsApp group link I'm just sharing in the chat box. Please join this group. This group, you can get all the updates as well. If you have any additional questions we might not cover today, we will request Dr. Narendra ji pose the session to help us with answering some questions. So
I'll answer all the questions on WhatsApp group. You add me there also, I'll answer to all of them.
Sure. I'll add Narendra ji also, but this WhatsApp group will also be, a point of contact for all the updates of imumz sessions, wonderful sessions like this. So I'll add Narendra ji as well. So you can join this WhatsApp group. The link is shared in the group. Right now, okay, if you are already in this some other group and you have a question, you can ping Yukti or me, who is already added in the group. No need to join this group. If you're not a part of any of the imumz WhatsApp group, please do join WhatsApp group. It's very important to stay updated. I'm taking questions of Manisha now. Manisha, please ask your question. We'll cover Manisha's question, Shruti's, Chandani's, Neha Chauhan, Pooja Shinde, Saloni Rastogi, and probably Dipali will try to answer. Okay, so the link is shared. You can copy paste the link. Manisha, can you please ask your question? Okay, Manisha, can you please unmute and ask your question? Okay, Manisha is not responding. Meanwhile, Shruti,
EcoSprint can be taken till 9th month starting. And blood thinners can be taken right up to the delivery.
Yeah, Shruti, please ask your question. Sorry.
A517 is normal. HCG 5000 is not required after 3 months.
Yeah.
Hi, doctor. This is Shruti here. So just want to ask, during natural delivery, is episiotomy done even now, or natural tear is allowed? And is there way we can avoid any exercise or anything we can do to avoid?
So there is a big debate going on whether we should allow natural tear or episiotomy. If you ask me personally, I am in the favor of giving a small, well-planned, correct episiotomy, which is neat and clean and which can be stitched neatly. If a tear occurs, it could be very ragged and it could go down to your anal canal, to your rectal, to the motion. And if that happens, then it is a big problem. If 3rd degree perineal tear happens, then later on you'll have a lot of problems. So I would say let a normal, well-planned episiotomy be given.
Okay.
Antenatal yoga can be started from 5 months, even earlier. Breathing exercise even from earlier. 27 weeks, my baby is not moving. Your baby is moving. You're not feeling it. You will feel it. Definitely ask your ultrasound person to show the movements. Anomaly scan says there's bilateral splitting of renal pelvis. Well, renal pelvis, if it is more than 6, then we need to do some chromosome testing. Otherwise, no problem. Huge fungal infection in pregnancy is very common. So please be careful. Bacterial infection and fungal infection in pregnancy should not occur. They will lead to preterm labor. So keep hygiene, use vaginal tablets. Follicular cyst and pubic hairs, don't worry, just get them treated. Diabetic, you need to treat. Normal delivery with cerclage is positive. Polyhydramnios, if it is very severe, can cause problem, yes. 10 millimeter fibroid is no problem. 10 millimeter means 1 centimeter, very small. Dengue fever can affect the baby, yes. Corona can affect the baby after delivery and because of the medicines. So be careful of both these fevers. Sciatica pain can interfere in normal delivery, so be careful of that. And if it is severe, then you might have to go cesarean. Low-lying placenta, if it is anterior low-lying and posterior 1 grade, then if you can have a normal delivery, only grade 1 which is touching the horse. Doctor can tell you normal and cesarean at 38 weeks later, or sometimes even during labor, not before. Fibroids do grow with this thing. Dengue with pregnancy can be dangerous. Clubfoot is the baby has foot that is not a major problem. It can be corrected after delivery. Cholestasis means your gallbladder works slow in pregnancy, so you are likely to get jaundice and itching. So take the liver tablets with it and use anti-itching creams. Safe to have sex till 32, 33 weeks, but not with pressure and not with too much of violently. So gentle sex, or have sex in between the legs and no penetration. Iron supplements are necessary for everyone. No acceleration in CTG report with 4 movements. It is sometimes the baby is sleeping, so we will try to wake up the baby by giving some stimulation or give a drip or glucose, and you walk around and come back. It will start accelerating. Fibroids can cause early pains, yes. High BP is 140/90 anytime in pregnancy. Operation possible for not having any. Ultrasound is very safe. You can have it as many times as you want. Hemoglobin for thalassaemic mothers at least should be more than 8. Other blood should be ready, and thalassaemic mothers should not take iron, too much iron, because they are already high. IVF pregnancy is like normal pregnancy, but if you are very high risk for IVF, like you had some diseases, you have operations, you are old age, then of course IVF is a high risk pregnancy. And cervical length, I told you, less than 2.5 centimeters, you need to have a circlage or a pessary put.
Chandni, can you please ask a question? We can take one last question. It's already 1 o'clock.
I think I have answered everything now.
Yeah. Okay.
Yeah. What is the last question?
One last question from Chandni. Please go ahead, Chandni.
Good afternoon, sir. I'm right now 32 weeks and my AFI is 18 to 19. I'm aware that it is high to normal, but my baby is also breech at 32 weeks. And I checked my sugar levels. It is like FBS 91. Like I know the cutoff is 95, but I'm like a bit conscious. Like, should I decrease my carbohydrate intake and increase my physical activity? And even my protein levels are less. I'm having my whey protein concentrates daily, like religiously.
So you need to be put on a high protein diet, low carbohydrate. Yes. It is still normal range, your AFI. And because your AFI on the higher side, that is where the baby is not fixing in the head. It is moving around. And if your sugar, placenta, everything is normal, this condition is known as Idiopathic Polyhydramnios. Nothing to worry about it.
Sir,
baby will become normal in labor. Don't worry.
Thank you, sir. Sir, FBA is 91 is normal, no, sir?
Yeah, normal. 100 tak normal.
And one more thing, sir. After episiotomy, like it is 2nd degree perinatal, right? Episiotomy is like the vaginal laxity, I know, thoda difference hoga hai, but it won't cause too much loose vagina, no, sir. It will contract slowly.
Yeah, it will contract slowly. If it is causing loose vagina, now we have Femilift laser vaginal therapies available everywhere. So you can get that done without any operation. We can do vaginal tightening if you have any.
Sir, if my mucosa is stitched well, it should not be an issue, no?
It will not.
Sir, and for stretch marks, should I apply moisturizer, sir?
Yes, absolutely. Absolutely must.
Sir, okay. Thank you, sir.
Thank you. Thank you, everyone.
One last
interacting with all of you.
Sir, one last important announcements I'm making. I know it's very hard for everyone to get answer the questions. So I posted a group link, and if you can't use that link, please message Yukti from our team. The number is mentioned here. This is a really, really wonderful session, one of its kind. I know that it's how helpful it was for all of you. So please drop a review or a rating of imumz app on the Play Store or App Store. This is one request we make from the entire team. That's very, very helpful for us. Please join the WhatsApp group, and most importantly, do your daily recommendations, whatever we're recommending, the meditations, music, the baby bonding activities. So these are super duper important. I can see many regular participants here. Every Sunday, we are coming up with one such experts, and the entire program of imumz is ideated from best experts like Narendra ji, Dr. Malhotraji, and one of the best yoga, Ayurveda experts, meditation experts across the country. So take care. It's a very productive Sunday we had. Answered all your questions. Don't forget to drop a review of imumz app, and a very big thank you to Dr. Narendra Malhotraji for taking time and showing such an important aspect which is not which we're not exposed to. So thank you so much for this innovative workshops, sir, ideating and explaining us and patiently answering. Dr. Narendra ji is also added in this new WhatsApp group, so you can ask the questions to him, follow-up questions. So have a great Sunday. Happy Sunday, everyone. See you soon.
Happy New Year to all of you. Happy New Year. Safe delivery. Do post your baby's picture to us whenever you deliver. Thank you.
Thank you so much, sir. It's a pleasure hosting you always. Thank you so much.
Bye-bye. Bye-bye.